The healthcare IT landscape is expanding rapidly. Modern networks now integrate autonomous AI agents, complex SMS multi-factor authentication systems, and third-party Model Context Protocol, or MCP, servers. MCP servers act as controlled intermediaries that allow external AI clients to query secure internal data. HIPAA Complete engineered a massive payload for 2026 to address these specific vulnerabilities, consisting of 12 comprehensively updated legal policies. This framework introduces entirely new categories of governance, like the AI and automated decision-making disclosure. It also deploys a fortified acceptable use policy that dictates exactly how users interact with third-party cybersecurity tools and sensitive network data. But drafting a watertight legal document creates a paradox. The strongest policy provides exactly zero mathematical or legal protection if the end user never actually reads or acknowledges it. Deploying sophisticated new security protocols while assuming users will voluntarily hunt down and sign the updated terms creates a critical vulnerability for the entire organization. In a traditional user journey, an IT technician logs into their dashboard, bypasses the Terms of Service link, and immediately begins interacting with protected health information. PHI includes the highly sensitive patient medical and billing records protected under federal law. This creates the compliance vacuum, the dangerous delta between the moment a new policy goes live on the server and the second a user's acknowledgement is verifiably recorded. Access occurring in this window is legally compromised. To close this gap, the software architecture must intervene and physically barricade the user from the dashboard until their consent is mathematically proven. The pre-login consent gateway serves as the structural solution designed to eradicate that vacuum. When a technician enters credentials, the system pings the database to check their 2026 signature status. If they are unsigned, the login sequence instantly halts. The user sees a centralized dashboard summarizing the required documentation, including the updated terms of service, the data retention policy, and the service level agreement. Under Section 19 of the Terms of Service, the user reviews the terms, checks the mandatory consent boxes, and applies their electronic signature to turn the system green. This front-end friction successfully transforms a massive legal update into an unavoidable user checkpoint. But the moment that user clicks I agree, an intricate mechanical process triggers beneath the surface of the interface. The system isolates the electronic signature as a distinct data packet. First, the ledger binds a precise timestamp. Next, it locks in the user's IP address. Finally, the system wraps the packet in cryptographic hashes of the 12 policies, sealing it against future tampering. This multi-layered process creates an immutable, legally binding audit trail. A simple front-end click has triggered a complex cryptographic reaction that proves definitive legal consent. Once sealed, the signature packet is routed away from the active authentication server and deposited directly into the system's secure audit logs. In accordance with the updated data retention policy, HIPAA mandates that this specific record must be retained for a minimum of 6 years from the date it was created. The signature creates immediate access today and provides a guaranteed, unalterable record for future compliance inquiries. Consider a high-stakes audit. A federal auditor demands proof that a specific technician understood the 2026 rules regarding AI tools and PHI handling. Instead of digging through paper files or guessing a user's status, the system provides immediate digital retrieval. An administrator instantly pulls a definitive compliance report with a single click. The report shows the exact timestamp, the IP address, and the specific version hashes of the document signed, satisfying the auditor's request with undeniable proof. By enforcing a pre-login gateway, HIPAA Complete physically binds legal policy and software architecture to user behavior, protecting the network and patients relying on it.